Why IT matters. Information technology is a field of knowledge involving the development, maintenance, and use of computer systems, software, and networks for the processing and distribution of data. IT has only been widely available for most businesses since the late 1980s. However, since then, information technology has rapidly evolved from the storage, processing, and transport of data to analytics, strategic differentiation, transformation of value chain, and competitive advantage. The article IT Doesn't Matter by Nicholas Carr proposes that the value of IT has vanished and is not much more than an infrastructural technology commodity, a transport mechanism of digital information. He states that with the standardization of technology, greater homogenization of IT's functionality, and a rapid price deflation, the competitive advantage of IT will quickly diminish. He explains that the companies which utilize IT to gain particular operating or marketing advantages gain dominance through economies of scale and brand recognition, a benefit that lasts longer than the information technology they employed to originally attain market dominance. He advises on a defensive position on budgetary spending for IT, spending less, following the market, and focusing on vulnerabilities of information technology. There is some merit to Carr's recommendation for cautious spending on information technology systems, as well as vigilance in the vulnerabilities of information technology. Despite his view, in the current business market, IT is an essential function that a business must possess. The advantage of IT, then, does not lie in the possession of this technology, but how it is utilized to operate and differentiate the business to a level of competitive advantage. The healthcare industry has not taken a frontline approach when it comes to the use of information technology. Nevertheless, many healthcare organizations are starting to use information technology to improve data storage and processing. Few pioneer organizations are starting to use information technology to analyze and evaluate their database to improve clinical outcomes and operational processes necessary in the patient care value chain. Epic Systems Corporation is the inventor of Epic Hyperspace, a comprehensive electronic medical record system tracking physician order entry, clinical decision support, scheduling, billing, web portal software, and data repository. Epic's competitive advantage resides in the comprehensive coverage of all aspects of delivering patient care, as well as the ease of use after a short training course. The license to use Epic software is usually purchased by the healthcare organization. Each user is provided with a specific username and password to log into the system. When a patient needs to make an appointment to see a provider for medical care, a scheduler makes the appointment after viewing the availability of a provider's clinic. On the day of the encounter, a nurse enters the patient's vital signs, medical history, and a brief comment on the purpose of the visit. The provider enters the physical evaluation and the recommendation to the patient, as well as lab orders and medications. After visit summaries are generated to inform patient instructions and follow-up plans. The provider codes the patient's diagnosis and enters the level of service. Coders assess whether documentation and billing is appropriate for the particular patient visit. If there are discrepancies, an electronic mail is sent to the provider for revision and acceptance. Billers use the level of service information to generate an electronic bill that is sent to the insurance company. Even though the Epic software is mainly used for healthcare organizations to obtain patient information, patients are also given specific usernames and passwords to access their medical information using web portals such as the Internet Explorer. In addition, patients are able to send electronic mail to their providers containing questions and requests. Providers then review and respond to their patients electronically. The advantages of the Epic Hyperspace system are tremendous. Through this system, patients are able to schedule their own appointments, review lab and imaging results, and communicate with their providers directly using the web portal. Providers and staff are able to access patient information, communicate with patients, staff, and colleagues, code and bill for the encounters, and place patient orders either using on-site computers or off-site remote access via the internet. One of the main disadvantages at this stage is retrieving specific patient information that can be useful for population research and studying groups of patients with certain medical diagnoses to improve the organization's clinical protocols and policies. Most of the data retrieval must be done manually due to inconsistent organizational processes of data input. Despite these deficiencies, it is currently the most popular and widely used electronic medical record system in the United States due to its characteristics of user-friendliness and simple workflow functionality. It is the most comprehensive electronic medical record software available and is utilized by large hospitals as well as university healthcare systems around the country. Epic system has been utilized at MultiCare Health Systems since 2001. Prior to this time, provider charting was accomplished by dictating into a small tape recorder. The tapes were then picked up by transcriptionists, transcribed within a few days, and faxed returned to the site of origin. Lab results and imaging results were reviewed via paper record that was faxed to the office. Prescriptions were handwritten onto prescription pads, and patient orders were written onto a triplicate provider order form. A paper chart containing all of the patient's medical information is filed in a cabinet that is located at the office. With the introduction of Epic Hyperspace, all of the medical information became available through the computer terminal. Orders are typed into the computer and accessible at the hospital, the operating rooms, and the emergency department. Prescriptions are also typed into the system and electronically transmitted to the pharmacy of the patient's choice. Drug interaction alerts, as well as a list of all active medications, are available to review. With providers typing clinic evaluations via use of smart phrases and smart text shortcuts, the need for transcription services are eliminated. These improvements allow MultiCare Health Systems to position itself as a cutting-edge and best electronically connected healthcare organization in the region while cutting operating costs. The future for MultiCare Health Systems using Epic Electronic Medical Record System is tremendous. If data can be obtained to assess specific diseases as well as the best outcome data for the various treatment protocols, this can be used to provide better treatment for patient populations residing in the region. Evaluating the clinical outcomes data for specific conditions such as cancer and procedures such as robotic surgeries allows MultiCare Health System to position themselves as leaders in treating patients with cancer or those who need minimally invasive surgeries. Knowing the presence of specific diagnoses allows focused marketing strategies to attract these patients to the institution. Despite theoretical concerns for the security of electronic information, there are currently no reported cases of information breaches from normal use of the Epic system. The Information Technology Support Team keep vigilant tracking of logins and system uses. Ultimately, then, it is not the information technology itself, for eventually all healthcare organizations will be obligated to utilize electronic medical record system, but how the information technology is used to strategically place the organization to have competitive advantage over other organizations in the region. The following are references which were used for this presentation. Thank you.